Hello class, my name is Howard Chavez and today we'll be going over the procedure of delivering a baby in the field. I have Alyssa Highland, she's a paramedic and she'll be assisting me today. So we'll go ahead and get started on what your procedure will be like when delivering a baby in the field. So obviously it's important to always wear your PSI and to be prepared for what's going to happen. So as you can see, we're making sure you have your scene safe and making sure everything's prepared. So we've prepared some pads and some towels around the mother to make sure we are ready for it. So those are all the kinds of things you'll want to start preparing before the crowning begins. When the mother's having contractions, be sure to record the frequency and the duration of the contractions to kind of help you know when the baby's coming. If you start to noticing crowning, know that the baby is coming and that you should be ready. So those are kind of things to do before the crowning starts, and we'll go ahead and kind of move on once the crowning does begin. So once you notice the crowning, do understand that the baby is on its way and it will be coming, so make sure you're ready. For the most part, your job will be to help support and guide the baby through the entire time of birth. So once you see the crowning, you'll want to go ahead and apply your hand on the head and apply gentle pressure. Do not try to be pushing the baby back in. You're just going to be guiding it for support. You'll be guiding the head all the way through its delivery. Once the baby's head is out, it will usually turn to one of the sides. At this point, you will want to make sure you tell the mother to stop pushing. And you want to do this just so you can make sure you can check the head. So once the baby's head is delivered, you want to check around the neck to make sure there's no, the umbilical cord is not wrapped around the head. If for some reason it is wrapped around the head, you will want to insert your fingers under it and pull it over the head, being careful with the mouth and nose of the infant. If it is wrapped around twice and you can't release it, you'll want to make sure you get enough that you can clamp and cut it and release the baby. So after the head is through the canal, you'll want to start applying gentle pressure. Do not pull on the baby, but you will gently guide the infant in a downward position to release the upper shoulders. Once the upper shoulders are through, it will be a slightly upward motion to help release the lower shoulders. From there, the baby will usually be guided all the way out. For this purpose, I usually want to keep the infant at or below the cervix level. We will be cutting the umbilical cord at this point just to make it easier for this demonstration. When cutting the umbilical cord, you'll want to have about 4 finger widths away from the baby, and you want to set a clamp, and then a clamp another 2 to 4 inches away and cut the umbilical cord off. Do understand that it is not necessarily a priority to try to cut the umbilical cord right away. You can take some time to settle the baby. It's not a priority to get it cut right away. So after that, you'll want to take a sterile gauze and wipe the nose and mouth of the baby. And then from there, you will start drying the rest of the body several times with towels and be stimulating the infant to kind of help it start breathing. Note that we did not start suctioning once the head was delivered. That is not necessarily a requirement anymore. There's no reason to start stimulating the suction, and it can actually cause bradycardia. So that's why they've been moving more towards wiping the mouth and nose after the baby is completely delivered. Once drying is complete, you can go ahead and wrap the infant. So an easy way is to just do a swaddle to wrap the baby to make sure you keep it warm. Babies have really small bodies and really big heads, so make sure you also apply a hat on it to kind of help prevent that heat loss from the head. And they can't shiver, so they lose body heat very quickly. So just making sure you are wrapping it and providing it the warmth necessary. After the baby started crying and it has been fully wrapped, make sure there are a couple things you would wanted to record at that time. So we're recording the time of birth, recording APGAR score at 1 and 5 minutes after birth, and then you can go ahead and give the infant to your partner or give it to the mother. Once you have done that, you'll want to kind of prepare for the rest of the delivery. So what we have left is the delivery of the placenta. So the umbilical cord will just kind of be hanging there. Do not pull on the umbilical cord to get the placenta. It will usually take up to 30 minutes. It can take up to 30 minutes. Sometimes it can be faster if the placenta has not been delivered by that point. You can go ahead and start transport and get them to the hospital. But once the placenta is delivered, it will, like I said, it usually will be delivered on its own. Once it is delivered, you'll want to make sure you wrap the umbilical cord around it. You'll want to place it in a towel and just wrap it, and then from there you can place it in a plastic bag and deliver them to the hospital. Continuing care for the mother is also very important. So there still may be some bleeding that continues on during the birth, so you'll want to make sure you have some sterile paddings to place over the mother's vagina. You want to have her straighten her legs, and from there you can go ahead and have her start breastfeeding to kind of help stimulate the uterine contraction and kind of help stop the bleeding. If not, from there you can also perform a fundal massage to help the bleeding control. Make sure you transport both patients to the hospital after that. If you needed to call additional help, that is also something important, because at this point you do have 2 patients. And that's kind of the basis of delivering an infant in the field. We will go over if there were any complications with the birth as well. So we just went through what it would be like if we had a perfect delivery with no complications. There can be several complications that do occur during a delivery, especially in the field. We won't go into too many details of those, but I did want to focus on what to do in case you have complications with the newborn after it is delivered, and whether it has to do with respirations or cardiac. We're going to go a little bit into that. So I mentioned a little bit about an APGAR score. The APGAR score does range from 0 to 10. Hopefully all of you are aware of that, but we're going to do a quick review of APGAR, and it does stand for Appearance, Pulse, Grimace, Activity, and Respirations. So each individual category gets a score from 0 to 2. For appearance, the infant gets a 2 for being pink, 1 for central cyanosis, or peripheral cyanosis, and a 0 for central cyanosis. If the pulse is greater than 100, that's a 2. If it's less than 100, that's a 1. No pulse, that's a 0. For grimace, if it has a strong cry, that's a 2. Weak cry will be a 1, and no cry will be a 0. For activity, if the baby's actively moving its limbs, crying, and just kind of moving all over the place, that's a 2. If it does have some flexion, but not really moving too much, that's a 1. And if it's limp or not moving at all, that's a 0. And then lastly, for respirations, if it has rapid respirations, that's a 2. If it has slower or irregular respirations, that's a 1. And of course, if it's apneic, that's a 0. So we're just going to kind of go through a little bit of the procedures of what to do. So obviously, after you have the baby, you will have dried it off several times, keeping it warm and stimulating it through the drying process. You want to make sure to keep that infant warm, but say after that, maybe you aren't having the most response from the infant, or the respirations and heart rate aren't up right now, so you have some concern or it remains to have central cyanosis, we'll go ahead and go into our procedures. So the first thing to remember is that any cardiac issue that an infant might have is most likely due to respiratory. So if you fix respiratory, you fix the cardiac. So with oxygenation, so you do want to start off with doing blow-by oxygenating, so just being able to take a non-rebreather and applying blow-by oxygen just by holding the mask above the infant's face for about 15 to 30 seconds. If after that you have no improvement in the cyanosis or the heart rate, that's when you will want to move on to try some positive pressure ventilation. So say that doesn't work, we can go ahead and use a BVM and start ventilating our infant. So similar to, you'll apply the mask similarly to how you would for an adult, except with this one you will want to make sure you're doing more small tiny little puffs for your respirations, and they're going to be about 40 to 60 in a minute. Do remember that infants need to breathe a little bit faster than adults. So hopefully after doing this you will see some improvement in the heart rate or the cyanosis occurring. It may take a little bit, may take a few minutes, but it usually should work. If for some reason you don't have some improvement with positive pressure ventilation, and either the heart rate's not improving or it's starting to decrease, that is when you may have to start doing chest compressions. Usually if it is below 60, it's kind of a big sign. The heart rate is below 60, it's a big sign you will want to get into those chest compressions. But do note, if you have a pulse of 80 and you've been giving positive pressure ventilation and it's staying at 80, or it's starting to decrease 78 or 75, or just anything below, not necessarily below 60, that is a decline in your patient, so you will want to start compressions with that as well. But give it a little bit of time and try the ventilations for a bit. But if you do have to do compressions, you can do the two-thumb method around the baby, or you can do the two-finger method with the chest. Either one works. If you do have to get to this point, hopefully you do have backup to help you do this. And you will want to do a 3-to-1 ratio, so for every 3 compressions, you'll want to give 1 ventilation. Remember that ventilations are very important for an infant. But that's kind of a quick summary of what to do in case you need to resuscitate a neonate. Hopefully that's never the case, but we should always be prepared for the worst.